a parent that wishes their child a good future, let me introduce to you Elgon International Health Institute, a school that has made a name in giving quality health education. Elgon is found in Mbale City, Naja Nakaloke Village, on Soroti Road, 7 kilometers from Mbale City. Elgon, we offer certificate and diploma courses like Medical Theatre Technique, Medical Laboratory Technique, Medical Records and Health Informatics, Pharmacy, and Diploma in Medical Laboratory Technology. Elgon, we have a bus for easy transportation of our students, a well-stocked laboratory, and a library that matches the standard. Registration for February to June is ongoing. Elgon International Health Institute for a better student.
Daniel, a consultant orthopedic surgeon from Mbale Regional Hospital. Before me is a team of the EOC, that's the Emergency Operations Center, and the Rapid Response Team, and the other members that are responsible for informing, clarifying, and equipping people with knowledge about the outbreak of the virus that we have. We are here to inform members here in your capacities that as of now, we have Ebola in our country, as it was on the press release by the PS yesterday. So we wanted to update members here that one, the case that was identified of one of the deceased, whose names will not be mentioned, was a patient in Mbale Regional Referral Hospital. But before coming to the Regional Referral Hospital, he had gone to various clinics within our city, Mbale City, seeking for treatment. So by the time the patient comes to us, we were not aware, despite the symptoms he had, were not very classical of the BV. So what did we do? We gave the patient the treatment. Because he was a staff in Mulago, he requested to be transferred to Mulago National Referral Hospital, where he was treated. But while there, the symptoms of Ebola were very classical, and that's when the samples were taken off. So only to confirm that it was Ebola. The confirmation was done when the patient was dead. So as of now, we have brought the deceased to be laid off today. We wanted to inform the leadership and the members here, and also the office of the RCC, that we need your support to combat this virus. As of now, we have started with the contact persons that we are trying to find out and get. The numbers are too big, but without your leadership and sensitization, we will not manage as the health team alone. So your leadership is highly welcome, and we need it to get this done in the shortest time possible, because when we leave it, it is a consuming fire. We are all aware that health is wealth, but being wealthy does not mean you're healthy. So before me, I would like to introduce the head of the RRP, and that's the EOC, and then the representative from the World Health Organization. I would like to allow them, speaker, to give me 1 minute or so. They say something before I can conclude this. Thank you so much.
Kiror, an operations officer at Mbale Public Health Emergency Operations Center. Just as Director said, following the declaration of confirmed Ebola outbreak in the country yesterday by the Minister of Health, as Mbale EOC, our work was to initiate coordination for preparedness and response to Ebola outbreak. And so yesterday we had one first coordination meeting with the Director General and the Rapid Response Team. And so what was clear from that meeting was that how do we engage the city and the district team? Because as you've heard from the director, this patient passed through our district and city. And so one of the guidance from the DG and Minister of Health is that we need to activate the city task force. And I'm happy the RCC here, who is actually the head of the task force, either in the district, but also in the city. And so it's a good privilege for us to be here first of all, to pass on the message about Ebola, and I believe we are the ambassadors, even when we move away from here, to sensitize our communities. Already there is a coordination force which is on the ground, and I'm happy to note that even part of the Mbale city team are in that task force. The CHO is here, and also the RCC is in that task force. And so we also want to thank the city team who have seconded staff who are working with the other response team members, and they're already in the field doing risk communication and community engagement, doing surveillance, but also doing setting up case management facilities within the hospital. So briefly, that's what I wanted to talk about. There are ongoing meetings right now. Even there's an ongoing national coordination meeting still on Ebola outbreak. So we want to urge all of us to take care, take caution, don't shake hands. Always ensure you wash your hands, soap and water, do sanitize, avoid crowding, and other prevention strategies should be embraced as directed by the Minister of Health in our communication. Thank you so much. Let me
incoming town clerk and the outgoing town clerk. All protocol is observed. Good afternoon. Yeah, as has been already said, we have an outbreak of Ebola. So as a disease, most people who get Ebola are likely to die. So we need to be very careful. What causes Ebola? Ebola is thought to be to live naturally in some bats called fruit bats, but oftentimes the infection is gotten when monkeys get in contact with half-eaten fruits from those bats. And maybe when humans get in contact with these fruits or monkeys, they get the infection. The challenge is that when humans get the infection, it very rapidly spreads from one human to another. And the spread is by getting in contact with fluids from that person or getting in body contact with that person. So they advise social distance as a means to prevent the disease. When someone has gotten Ebola from a confirmed case, they are asymptomatic for a period of about 2 to 21 days. When someone is asymptomatic, unlike COVID-19, they cannot pass on the disease. But once they develop symptoms, they will be in position to pass on the disease. So because of that, we need to identify all the contacts of people who have been confirmed to have Ebola. And every day for 21 days, we have to follow up those people to understand if they are getting symptoms. So we do that, we call that contact tracing and follow up. If they survive the 21 days, then we think they have not gotten the disease. But within those days, if someone gets the infection, they will be evacuated from the community. This is often difficult, and we need the support of the leadership to evacuate people from the community. Because Ebola comes with a lot of myths and misconceptions. Oftentimes people think there is no Ebola. People will say it's due to its witchcraft, which is disturbing them. So we really need the different pillars of the response activated at the different levels. So here in the city, we need support to activate the coordination mechanism, which is led by the town clerk, but also case management and infection prevention and control. For case management, as a city, we need to identify, suppose we got someone who is suspected to have Ebola at this time, where can they be taken? I think it's something which should be looked into by the city health office. Then all health facilities should identify an area where they can put someone who they suspect to have Ebola before the different lab people come in to take samples. There should also be screening at the health facilities. The big challenge about Ebola is it presents like some of the common diseases you know. Ebola presents like typhoid, Ebola presents like malaria. These other things which are feared of bleeding from the whole body coming towards the end. So if we are waiting to see bleeding, chances are very high we are going to get Ebola. So how do we protect ourselves? The basics, it is soap and water. Please let's wash our hands regularly. The usual hugs, the shaking of hands, please let's give it a break for now. Ebola also interferes with our cultural values. We love our dead ones. When we lose people, we want to wash them. Everyone has to do some rituals on this person. It's not that we don't respect people's rituals. But when someone dies of Ebola, that is the time when the disease is rapidly transmitted from one person to another. So we've also gotten a self-dignified and burial team to help with the burials. As influential persons in your capacity, it is important that you tell the different people in your regions to embrace this. It's only temporary, but once the Ebola is gone, people will go back to their cultures. So I won't take much of your time. I thank you for the podium, but we are ready as WHO to work with the city to build capacity among the healthcare workers, but also to work to strengthen the different areas. One thing that is needed from the city is a response plan, and also providing submissions to the situation report to be given, to be provided at the director's office.